If your joints have been feeling stiff and painful lately, it might be more than just everyday wear and tear. It could be early signs of rheumatoid arthritis. Hi, I'm Dr. Adam Barron, and today I want to talk to you about something I see often in my practice: the early signs and symptoms of rheumatoid arthritis, also known as RA. Some of these signs are pretty well known, like joint pain and swelling, but there are also some less obvious ones that can easily be missed, especially in the early stages. That's why catching it early is so important. The sooner we recognize it, the better chances we have to protect your joints and prevent long-term damage. So, what exactly is rheumatoid arthritis? RA is what we call an autoimmune disease. That means your immune system, which is supposed to protect you from infections, accidentally attacks your joints. This creates inflammation, which leads to joint pain, swelling, and stiffness. Over time, if this is left untreated, it can cause permanent joint damage. For some people, the symptoms build up slowly over a few weeks or even a few months. For others, it can show up more suddenly, where multiple joints seem to flare up within a week or so. The most common thing people notice is joint pain. It often starts in smaller joints, like the fingers, wrists, or toes, but other joints may be involved. It can also affect other joints like the knees, shoulders, elbows, hips, and even the jaw. The pain is usually daily, and it tends to be worse first thing in the morning or after you've been sitting for a while, like after a long car ride or sitting on the couch watching TV. Many people also notice their joints feel tender when they press on them, even when there's no obvious swelling yet. Swelling is another common sign, and it might be subtle at first. Maybe your rings don't fit like they used to, or your wrists look a little puffy. For others, there could be a large amount of swelling that is more noticeable right away. RA often affects both sides of the body, like both hands or both knees, but not always. I've had many patients where it started on just one side, and it was still very much rheumatoid arthritis. This may make it more difficult to diagnose early on. Morning stiffness is another big clue. That's very common. In RA, the stiffness usually lasts at least 30 minutes, and sometimes all day. It tends to get better slowly as you move around. This is different from typical wear and tear arthritis, where stiffness usually goes away pretty quickly, often within 10 or 15 minutes. And then there's fatigue. I don't mean just being tired after a busy day. This is a deep, frustrating kind of tiredness that sticks around no matter how much you rest. In fact, some people feel this fatigue for months before they even notice joint pain. There are less common symptoms that show up in early rheumatoid arthritis. This includes some people losing weight without trying. Others may run a mild low-grade fever that comes and goes. Tingling or numbness in the hands is common because inflammation can irritate nerves and cause carpal tunnel syndrome early on. Dry eyes and dry mouth can also show up in some cases. And occasionally, people develop small to large bumps under the skin, especially around the elbows or on the fingers. These are called rheumatoid nodules. When doctors suspect rheumatoid arthritis, we often check blood tests for markers like rheumatoid factor and anti-CCP antibodies. These can be very helpful, but here's the catch. Not everyone with RA has these antibodies. In fact, about 20 to 30% of people with rheumatoid arthritis are negative for these blood tests. This is called seronegative rheumatoid arthritis. When these antibody tests are negative, sometimes the arthritis gets labeled as regular arthritis or osteoarthritis, especially if the swelling isn't obvious yet. Often, older people with rheumatoid arthritis are told that they have osteoarthritis because osteoarthritis is much more common. This doesn't necessarily mean the doctor did anything wrong. It's just that without positive blood tests, the diagnosis isn't always obvious early on. We base the diagnosis on the whole clinical picture. We may also check for other supportive blood tests like markers of inflammation called CRP and sedimentation rate, or other antibodies called anti-MCV and ANA. X-rays can be checked, but often do not show changes of rheumatoid arthritis early on. No single test makes the diagnosis. It's really about putting all the pieces together. It is important to get a correct diagnosis of rheumatoid arthritis. We have good treatments that help reduce inflammation, ease your symptoms, and protect your joints. This is not medical advice, just educational information. Thanks for watching, like and subscribe. Also, if you found this helpful, consider sharing it with a friend who may need it.